The South Carolina Telehealth Alliance is a collaboration of many healthcare organizations working to expand telehealth across the state. Since 2014, the SCTA has organized efforts through a statewide strategic plan, which allows SCTA members across the state to work collaboratively to expand telehealth programs and to align telehealth education, broadband and internet infrastructure, and advocacy and awareness efforts. In 2021, the SCTA launched a new strategic plan format focused on grouping telehealth services by the value they bring to the state. In this new series, we will dive into each strategic bucket a little deeper and take a look at the impact these telehealth programs have brought to South Carolina. All primary care clinics in the state with emphasis on health professional shortage areas will have access to integrated services through telehealth partnerships.
These services are specifically designed to be collaborations with a distant and a local office together. So providing telehealth is wonderful, but staying local is difficult. And in the end, all healthcare becomes local. When you get sick, you need a local hospital and a local clinic. You can do as much as you can at a distance, but you will always need some sort of local partnership. So how do we both work locally and at a distance is what this is about, and leveraging the primary care office. And so the services are designed to be delivered at a distance, but in partnership with a local office, and working through that office to extend what both parties can do. So some examples would be mental health care, where the local primary care provider is providing the basic levels of care, but we will provide integrated care where the psychiatrist can give advice, maybe not manage the patient, but give advice to the local practice, and developing that out to provide counseling service and those kind of things that may not be local to that office, but they still are not a referral out. The service is part of what that office does. Another example is diabetes remote patient monitoring, which is done in a health system, but we shouldn't exclude the small and rural clinics being able to tap into it. We also don't want to monitor those patients without letting them be part of the local healthcare clinic, which is importantly really taking care of them. And so what we do is we make sure that the devices the patients go home with that get their glucose readings go to a cloud that both our centralized team here in Charleston or the local team there in the rural community can both access it and both manage the patients, agree upon the protocols for how we treat the patients. But in the end, the care is local with a distant resource collaborating. So primary care support is about collaboration through a primary care office. It's extremely important to bring resources into a community but not bypass local healthcare infrastructure, and that these are what it's designed to do. It's also important to focus on the mission of primary care. So you can't do all types of specialty care through a primary care office. They just don't have the time and the resources and the space. But you can tie the mission of the primary care office with the extra levels of resources we can bring in. So we typically will focus on weight management, behavioral mental health, diabetes management, things that are the job of the primary care office, but the primary care office could always use more resources and more help. Primary care support services are also sometimes a little harder to get your mind around because the modalities are often different. So there might be a video into an office where you see a registered dietitian when you walk in the office, but it's via video, or it might be a glucometer going home with the patient and you're sharing that data. The telementoring services, such as USC's telementoring hepatitis C or the various Project ECHO services, what they do is provide via telehealth case discussions on complicated patients, and they talk through with specialists from different parts of the state how they might manage it and overall raise the level of care in the primary care office. And so there's a number of different modalities and tools that are all brought together because they're all trying to work through primary care.
I just want to be in the newspaper. I want to be famous for being a great football player and a great person. My dad, he always showed me him in magazines. Well, not in magazines, but newspapers. Like these old newspapers about his team and how good they were. He was successful. He won a championship, and I want to be like that someday. We practice together. He just helps me of firing it off and show me moves on the defensive line.
He's really good at football when he put forth the effort.
I suggest practicing because it makes you better and you can get the exercise out of it. I've known Dr. Simmons 11 years and I still know him because he's my doctor and he's pretty, funny and goofy. He likes children a lot. He likes to provide them with good things. He likes to help them and make sure they have a successful life. He had put me in this program for this nutritionist. It really helped me with my choices and my goals I should meet.
They'll come in like their regular visit, they'll check in through our nurse, they'll come to our telemedicine room, and we connect our patients with a specialist from MUSC.
We can see her and then she can see you. And it's like a computer.
For years we're sitting around and kids are coming for strep throats or for sprained ankles, but then they come in for obesity and we see them once a year. And so we weren't treating it very effectively. When we decided to focus a lot more aggressively on it, we decided one of the biggest things we wanted to do was basically deal with nutrition. And MUSC having that realization that said, hey, you know what? We have those services.
We have been doing the telehealth for about a year. She really did give us a lot of insights on just eating healthy and choosing how to work out, when to work out because of our busy schedules with him being in sports and me working full-time. It saved me a lot of money and time.
My endurance and my stamina, it really helped me because sometimes, as soon as the third quarter starts, I used to get really tired. But now I can stay in longer than I could last year. I feel glad that I did it because it helped me with my choices of eating right and being healthy so I can live a long life. I want to see what happens 10 years from now. I want to see what the generation will be like we flying or we have superpowers or something like that.